Numbers show the cases of coronavirus here in the U.S. have jumped to more than 500 cases. That's up from just more than 100 on Friday. The states hardest hit include Washington, California, and New York, all of which are reporting more than 100 cases each. A total of 22 people have died as a result of coronavirus, 19 in Washington, 1 in California, and 2 people in Florida. Worldwide, we're seeing cases spiking in Germany and Spain. And right now, 16 million Italians are currently under unprecedented lockdown as that country tries to slow the spread of the virus. We have team coverage tonight. Tanya Dean is looking at precautions being taken at Vivint Smart Home Arena.
Mike Anderson is talking to a teacher from China stuck in Utah because of this outbreak. But let's start things off with Jed Bull, who is live in Murray with how Intermountain Medical Center is working to keep people from spreading the virus in the hospital.
That's right, Mike. Intermountain Healthcare tells us that the hospital is safe and they don't want anybody to feel panicky about coming here to get their health care. But they put restrictions on visitors in place today to keep the coronavirus from any kind of spread here.
We're really looking to, first and foremost, protect our communities and our patients.
Anyone who is sick should not go to the hospital to visit a patient, nor should they accompany a patient who's going in. New rules for all Intermountain hospitals and clinics.
It is a rapidly evolving, changing dynamic that's occurring as we learn more about this virus.
Discouraging any visitors under age 18. No visitors are allowed to see patients who have a confirmed case or possibly have COVID-19. And they're asking visitors to wash their hands or use hand sanitizer before and after leaving a patient room.
It's still safe. Our hospitals are safe. We're well prepared. We have great care clinics. We want people to come to seek care that need it.
Following guidance from the CDC, the Utah Department of Health, and the Utah Hospital Association, telling caregivers in their facilities to stay home if they're sick. If they've traveled to countries with coronavirus concerns, they're also supposed to check in with employee health nurses
that are screening those individuals for symptoms, also implementing home monitoring. Mostly that involves taking your temperature and reporting any kind of symptoms that would go to the state health department.
And tomorrow, Intermountain Healthcare is going to show us one technique that they're using for screening patients for potential COVID-19 without exposing this facility or their caregivers to that virus. Guys?
All right, Jed, thanks. Other hospitals are taking precautions too, Mike.
University of Utah Hospital also preparing for the possible increase of COVID-19 cases. They now have negative pressure tents set up inside, or rather outside, the hospital.
If a patient presents and is coming to the ED by personal vehicle because they're not feeling well or they're concerned, they will be triaged out front in a pre-triage tent.
Now, at that point, anyone with respiratory issues will be treated in the negative pressure tents. If they need more treatment, they will be moved directly into a special area of the hospital. The purpose of the freestanding facility is to treat without the risk of spreading the virus to other patients or staff members.